Starting in September 2024, providers of adult long-term care waiver services will need to enroll with Wisconsin Medicaid through the Forward Health portal.
Who is affected?
The new provider enrollment application is how Wisconsin Medicaid will certify you. It is for providers who serve members and participants in Family Care Partnership, the Program of All-Inclusive Care for the Elderly, or PACE, and IRIS, or Include, Respect, I Self-Direct. It's also for agencies, organizations, vendors, and sole proprietors who provide services listed in the DHS MCO contract or the IRIS Service Definition Manual. Keep in mind, DHS may refer to those who serve adults who are older, have a physical disability, or an intellectual or developmental disability as providers of adult long-term care waiver services, or as home and community-based waiver services, or HCBS providers. Individual self-directed support workers and individual participant hired workers are not affected. They will continue to complete Medicaid certification using the current processes. If you are already enrolled with Medicaid and want to provide waiver services, you will be able to access the portal to add adult long-term care waiver programs and services to your current Medicaid provider enrollment.
Why the change?
DHS is changing the provider enrollment process to centralize how DHS or Forward Health screens, certifies, and maintains information about Wisconsin Medicaid providers, while complying with state and federal rules. After enrolling, providers will be listed in the public-facing Forward Health Provider Directory, making it easier for members to find services. Providers will also be able to easily choose the services they want to deliver and what Medicaid programs they want to be providers for. And providers can easily give information directly to DHS for background checks.
What support is DHS offering?
We're here to make this change as easy as possible. DHS will offer training materials and live sessions for you to learn how to access and complete the application on the Forward Health portal. We'll also help you understand what information you'll need to enter and how that information will be reviewed.
What information will I need to have when I complete the application on Forward Health?
You will need to have your tax identification number, or numbers, National Provider Identifier, or NPI if you have one, your address, name and address of owners and managing employees, and any applicable professional license or certification information.
What happens after I submit my provider enrollment application?
After DHS reviews and approves your application, you will become a certified Wisconsin Medicaid provider through Forward Health. You'll continue to contract for waiver services with MCOs, be selected for services by IRIS participants, and onboard with FEAs. The deadline for you to enroll with Medicaid using the Forward Health portal is January 1st, 2026. If you have not done so by then, claims you submit to MCOs and IRIS FEAs for waiver services will be denied.
Find more information about the Adult LTC Waiver Providers Program in the Forward Health portal. You can also sign up for the LTC waiver emails and learn about upcoming town hall meetings.